and good afternoon. Welcome. Thank you so much for joining me. I'm Rachelle Wilson for Make Some Intelligent Noise, Multimedia Justice Movement. And today I have a very special guest that is joining me, as you can clearly see. And for those on the radio, you won't see her, but you'll hear. Today with me is Lieutenant Governor Dr. Bethany Hall-Long. And so we thank you tremendously for doing this interview with us and for talking with us.
Yes. Well, thank you. Oh my gosh, it is such an honor and pleasure to be with you. I'm a public health nurse through and through.
Yes.
So when I have a chance to be with a mom, a woman who is really advocating for the community, I jump at the opportunity. So I look forward to a fun conversation this afternoon. It's a welcome reprieve
yes.
from all the COVID work and everything else that's going on, the reports. So this is exciting. So
yes.
Thank you for what you do and the platform you have and really trying to help our community. Thank you so much.
Yes, I appreciate that. And I wanted to start off our conversation by making sure that people understood what a lieutenant governor is and what position that is. But before I ask you that question, because of what you just said, I gotta say,
yeah.
I am a mom, and so are you.
Yep.
We're both moms.
Yep.
And I think kindred spirits, in as much that not only do I use my voice to advocate for the community, you use your position to advocate for the people as well. And so I admire that and I respect
Thanks.
That about you. And so now make sure that everyone knows, what is the position of a lieutenant governor? What is your job?
A lot of people get that confused sometimes. They get it mixed up with an attorney general. They get it mixed up. Lieutenant governors are basically known as the second in command in the state. And over the past 2 years, believe it or not, I served as the chair of the National Lieutenant Governor Association. And so I had to work across the country with all the different states. And most have a lieutenant governor. Some have a secretary of state. The lieutenant governor for Delaware, constitutionally, I preside over the Senate, which is a group of 21 incredible legislators from up and down the state, depending on where you are. Hopefully you all know your senators.
Yes.
If not, get to know your senators.
Yes.
And I have the opportunity to do one of the jobs I really enjoy the most. That really is impactful to give people second chances. That is called chairing the Board of Pardons, which is a really important opportunity. Now, some states, lieutenant governors do not do that. Some states, they oversee education. Some states, they may oversee business and development or tourism. Everyone's a slight difference. But in Delaware, constitutionally, presiding over the Senate, the Board of Pardons, and God forbid something happens to the governor, one would step up and go into the role of governor.
Yes.
So those are the constitutional items.
Right.
Now, this office, as you could tell coming in, and you were very gracious to bring snacks to my office. I have a very small office. And there are, a handful of folks, but they do the work of probably 30 or 40 staff. We have been busy. We hit the ground running with lots of projects. So as we talk today, I'd be happy to talk to you about some of those pillars of items, whether it's mental health, whether it's the pandemic work, whether it's census, whether it's early childhood. We have really tried to listen to the community. And for me, when I ran, I had indicated I wanted to really build on the work I had done both as a member of the Delaware House of Reps and as a member of the Delaware State Senate to really take that legislative knowledge and turn it into an executive branch. So moving from the legislative branch to the executive branch.
That's a lot of roles and responsibilities to take on, and again, that's woman power.
Yeah.
That's
Getting
woman
things
power.
done. Right.
Yeah.
The issues we hear about, right?
I want to dig in a little bit on a personal level, because you are a woman and you are the second most powerful person in the state of Delaware, politically speaking. And so, as a woman, what was that defining moment for you to say, you know what, I'm going to put my hat in there and I'm going to become someone who works for the community and become the lieutenant governor?
Right. Well, and I think like most young women listening in, and men too, I as a mom of a young man, we start in life and we have a journey and we have a path. I am a professor of nursing. I take care of people. I still teach at the University of Delaware. You saw me out doing the vaccines.
Yes. Dancing.
So I was a dancer in college, although we won't be dancing probably today. But what defining moment for me was really making sure to be able to have a seat at the table. I found if I wasn't at the table, the things I cared about were left out on the menu, so to say. And I learned early on to work with homeless and mentally ill and veterans. My husband's a military veteran. I was born down in Sussex on a farm near the beach, but had the opportunity to travel with my husband some. And it was during those experiences where I had an incredible mentor that talked about nurses needing to be in policy. And it wasn't something I had thought about. It was actually Dr. Hazel Johnson Brown. She was the first African-American female general in America. Not everybody has that experience.
Yeah, that's powerful.
But I want to make it clear to the listening audience, I wasn't born with a golden spoon. I came from a working family, a farm family. I was the first person to go to college. I had a grandmother who had to quit school in the 8th grade to work behind a mule, and she always said, young lady, get your education and go forward. I share that caveat because I think a lot of persons don't think about running for office or stepping up because they assume you have to have this or this amount of money or this. You go with your heart. My heart drove me to help more. I found if I wasn't at that table, a lot of the persons I cared deeply about who had mental illness or homeless as veterans didn't have a voice. And so I had some encouragement from folks to consider running. And so I ran. I lost the first time I ran as a state rep, but came back and have continued ever since to see where I can make an impact. I felt really fulfilled after 9 years in the Senate and 6 years in the House that legislatively I had made some real changes to make Delaware stronger and healthier. Yeah. Whether it was, addressing kindergarten coverage, health coverage, expanding cancer services, to working with agriculture and infrastructure in our state. But I knew that the next level, where I could serve in the executive branch, I could really begin to move the needle. And I have a real interest, as you do, in social justice, environmental justice, criminal justice, and recognize that the lieutenant governor had the Board of Pardons. And we can talk about that a little later.
Yes,
I've worked really hard to change the Board of Pardons and some of the processes, and so it was a personal interest. So I would encourage listeners, they may not think today that they're going to run, but I would encourage them to get involved, to stand up like yourself, to work hard to improve the community. Whether you're here for good housing, gun violence, clean drinking water, whatever motivates you, don't be on the sideline. Politics is not a spectator sport.
That's right.
People need to be involved.
That's so wonderfully said, and I think that, for the listening audience, for men and women, but again, just really empowering the little girls out there, be inspired by the message of what you're hearing today. As you heard her, she came up on a farm. She didn't have a silver spoon in her mouth. Okay, you're a real human. You're a real woman with a heart and a spirit and a soul. And I think that that's important. So often we see the politicians. They're just politicians, and it's all about other things besides helping the people. But whenever I run across real human beings, especially women, I am very attracted to that.
Good.
So, my good friend is your good friend as well, House Representative Melissa Minor Brown. Mimi, that's my baby.
I was with her Sunday getting vaccines.
Yes. And all three of us are mothers of sons. So I think that's a very strong link. But my advocacy kind of comes from being the mother of an incarcerated son. So the prison system, the pardons, all of that's important to me.
Absolutely.
And that's what I advocate for with Make Some Intelligent Noise. But you're a doctor. You are Lieutenant Governor Dr. Bethany Hall-Long. Let's talk a little bit about that. A doctor, professor. Talk about that.
Sure.
And you administered 3,000 COVID shots yourself, right? Something close?
At least, maybe more in testing. And it's a team effort. It takes a village to work in this area. And I have my PhD in nursing. As I mentioned, I had a fantastic mentor, the first African-American female general. And, she inspired me. But I've had a lot of people who've helped me along the way, different faith leaders, different community leaders. I have a great friend who is a physician, Dr. Sandra Gibney. I was with her last night at a TAC addiction dinner, and we were talking and working. We go on the streets in our PPE. We've done COVID testing.
Really?
But, we go out, we do COVID tests. We help persons who are mentally ill during the COVID crisis, housing, but working with state resources, because it's really, really important as women and men who are listening to really have connections and partners in the community. And like Representative Minor Brown, as a mom, it is important to have that empowerment component. My staff work really hard. One of the other things I have the honor of doing is nationally something called Million Women Mentors. So to all the young girls listening in, and guys too, STEM is something we don't talk about. So me as a nurse, me as a professor, really got intrigued with science and technology. A lot of times young girls and guys are turned off, and we shouldn't be. Yes. We still only represent a third of STEM in this country as women, and 50% of employers are hiring women.
And say STEM, what is that again?
Science, technology, engineering, and math.
Gotcha.
And guess what? Delaware STEM star, and she goes on national television all the time, and you all should hear from her, is Jackie Means.
Okay.
She is from Southbridge.
Right.
A young girl.
Yes.
And has worked really hard to advance in her education. And she is really working with a number of folks to educate them on opportunities. Now, not everybody has to go to college, but having a career. And we know those are important factors around preventing what is known as the pipeline to prison and other things. So having those opportunities. So I know Governor Carney and others are working really hard. Like today, they announced a report around recidivism and reentry. And Mimi is on that. Representative Minor Brown's on that.
Yes.
And it includes programs like we're putting rescue monies in right now to educate the future workforce. So to make sure people have a career.
For our returning citizens.
Yes, for returning citizens, as well as young kids listening in middle school and high school, getting them early on.
Yes, catching them before they get
in trouble or in the community, that they have an opportunity, whether it's manufacturing, whether it's welding, whether it's a career with a union or construction or healthcare or technology or finances and career in legal services.
You know what I've come to learn as a woman who's just from the hood, most of our, what we would call or title as drug dealers, so to speak, right? The ones that are on the corner posted up doing those kind of things. They're mathematicians. Like, they're literally mathematicians.
Well, they're business entrepreneurs.
They're business entrepreneurs. If they would just put it in the right perspective, they could make a lot of good
And
moves.
that sounds like a conversation we have every month at the Board of Pardons. We have that conversation with persons who are remorseful, who have served significant time incarcerated for choices they maybe made in a split section, or for those who have those business skill sets, who have the math skills, who have the marketing skills, who just put those in the wrong direction. They
could market glasses, anything other than that stuff.
Products and clothing. And we have success stories. Last evening, I was celebrating with attack addiction persons who had substance use disorder, who were in drug dealing, who served significant time. One of the gentlemen last night, huge success in construction now, has a $6 million a year profit, has hired persons. So he took the trauma that he experienced as a young adult, his unfortunate incarceration time, to become educated, to get business skills, so that when he was released, he had a whole new opportunity, and he's giving it back. He's paying it forward.
Yes.
And that's what we have to do in a community, is pay it forward.
Pay it forward.
Not beat each other up, but uplift each other. And that's something I love about my office of Lieutenant Governor. We uplift, whether it's mental health, whether it's making sure we have a correct census that was done this year, whether it's making sure that we have early childhood as a high platform. Really important.
I think getting the early childhood thing is very important, as a word that you mentioned earlier. Two things. You said so much, but I want to try to remember. You said, first of all, you don't have to always have these paper educational pieces of paper that says you're this great person in order to achieve goals in life. You can maybe just be smart enough or gifted enough to do something, but don't sit on the sidelines and do nothing. That's when you're wasting all the talent. And the other thing that you said was that they're not even fully developed. Many of the young folks, things have been on the uptick. Crime a little bit has been on the uptick in some of the hot spots here in Wilmington. And maybe some of that is because they're young and COVID and the pandemic and the trauma and the... Can you talk a little bit about our young people and the trauma from the pandemic that may be causing them to misbehave?
The pandemic absolutely has shown a light on a lot of the inequities. Inequity in physical health, inequity in mental health, and inequity in our communities of color, our Black community and our Latino communities. And so my office has been so pleased to host every other week for a while now, monthly Black leaders calls, Latino leaders calls, and faith leaders. And something we talk about, and a common denominator in all of those, is the impact on COVID with social isolation. And now that we're, quote, out there, and even though we're still not safe, if you're not vaccinated, wear the mask, wash your hands, get your COVID test, please do all those things. We are really seeing that young adults and the gun violence uptick has occurred. They're out, they've been in their homes for like a year, and we had trauma before. Public health, gun violence is a public health crisis. Believe it or not, in my master's program in the 80s, I wrote papers on gun violence in the 80s. We got a little ahead. We did some policies in criminal justice that were way too punitive. We've learned from those lessons, and we've learned a lot that we need to be doing more early, the trauma, the ACEs. Our First Lady, Tracy Quillen Carney, has really adopted with our Secretary of Youth and Family Services, Josette Manning, a whole platform around acquired childhood exposure, gun violence, substance abuse, domestic violence, the things that our children, particularly in communities of color, have a way higher exposure. It affects the physical brain. It affects your chemical brain. It affects your neurology. It changes who that person is. So we're working really hard with great leaders like yourself and others in the community to educate, to talk about how we change those social determinants. Our consortium of mental health providers and behavioral health experts have tools and toolkits for the listening audience. If you need help and advice, we have a hope line. We have connections for people to turn to and to work through. And it's nothing to be embarrassed about.
No.
It is okay not to be okay.
It's okay.
It's okay.
Because really, are any of us really okay?
No.
Every life has a little something going on. None of us are perfectly okay. So if someone in the community wanted to help and be a part of that, is there a way that they could do that? How would they go about doing that? Because your office is amazing.
Thank you.
I love the people that work in your office.
Thank you.
How would they do that?
Well, our office is just one little drip of the faucet. There are so many incredible resources across the state.
I mean, for what you were saying that you're
trauma,
doing.
right. Well, our Behavioral Health Consortium, Georgina Class-Peters, you can outreach to our office. You can email Bethany.Hall-Long at Delaware.gov, Bethany.Hall-Long at Delaware.gov, or call 302-577-8787, 577-8787. And if you are really also interested, we have a consortium that has lots of committee openings dealing with education, family readiness, access to treatment. Really important to you today is our Criminal Justice Reform Committee with Behavioral Health Consortium. We have done a ton with law enforcement to look at crisis training, to improve on and working with the Attorney General's office, working collaboratively across the board with other agencies to really start to look at diversion. That when a person gets arrested with a substance use crime, they've been shoplifting, that they don't immediately get an arrest record and taken to prison.
Cart
Get
them
them
off to jail.
into treatment.
Yes.
So two people getting that option has been a huge shift in mindset. It's taken some time, and I give credit to leaders who were out there ahead of their peers, some in the county, some in municipal, and some in the state law enforcement and correctional community, working with the Hope Commission and many others to really try to prevent reentry and to help people get help. When a person is shoplifting, when a person is acting out in violence, when they are not of clear mind and they hold up a grocery store clerk and they're high on substances, or they're driving intoxicated,
or desperate.
They're calling out. It's an unsignaled cry. So we have committees. You can join. You can give us ideas. You can give us testimony. You know, we will connect you with the right agency.
Yes.
If you're a foster child, today our governor just signed a bill going to cover college expenses for children with foster care.
Bravo!
Who are transitioning out, who don't have support.
Yes.
We have programs for you. So we don't want people to be afraid to ask for help. Ask for help.
And if I could just inject here for anyone listening, for the viewing audience, for my Facebook audience, I want you to know, honestly, I can feel her humanity. Like, she's a real human being. She's not unapproachable.
No.
If you approach her with love, I believe you're going to feel that back. I met her at the park, and we were dancing. So
there was music.
There was music. Yes. And Matt Den was there, and everybody was there. We were having a good time. Michelle Harley. So
yes, Michelle, hello.
So
Xanthia, Oliver.
All of them, Oliver, all of them were there. Yeah. So I do want to get back on to two other topics. Again, you're moving faster than I can, but I love it. We're so off script at this point. It's okay.
Your questions. That's okay.
So I know, right? So you are on the board of pardons.
Yes.
Tell us about that, and I've got to ask you the tough question. Do you foresee, at least somewhere in the future, that there'll be a more diverse board, where we can include more brown and golden people on the board?
Well, it's an interesting conversation piece. Right now, constitutionally, the Board of Pardons gets confused all the time with the Parole Board, all the time. Two separate things, so let me explain those first. Board of Pardons right now is comprised by constitutional law, and it can always be shifted and changed. I mean, somebody could always make an introduction to change. It would take a little effort because you'd be having to change some, constitution and some things, right? It would take 2 rounds of the legislature. Right now, you have your auditor, you have your treasurer, you have your secretary of state, you have your chancellor, which is a title for a fancy judge, right?
Right.
All right, if you don't know what a chancellor stands for.
Right.
And then myself as lieutenant governor. The lieutenant governor gets the honor, I consider it a real honor, of chairing the board.
Okay.
We meet monthly. Now, there's been different processes put in place. I'll explain some of the things that we've changed based upon what I heard when I ran in 2016. We made some significant changes working collectively with the board. So we have the Pardons Board. Those are for persons who have, felonies, right? And some of them could be things you did when you were young and not using your wise brain or under the influence, with weapons or beating someone up or driving drunk, a felony.
Yes.
And there are sometimes misdemeanors that come along with those.
Yes.
Now, we've done some criminal justice reform over the past few years with the legislature, both Matt Den and the Jennings and other attorney generals, to really change some of those processes as well. In turn, what we have done is with the Board of Pardons is worked really, really hard to modify the process. But to get to your question about diversity, Chip Flowers, when he was treasurer, he was first, I believe, probably one of the first African Americans to probably serve on, I don't want to say for sure the first, but one of the first, maybe, to serve on that board. Mm-hmm. I think if anyone's interested constitutionally, they can always run for those offices. Yeah. You can't run for Secretary of State and you can't run for the Chancellor, but for those other positions. Certainly, people can do legislative processes to look at changing that structure. The area where I find the most impact, where we have diversity, where I have, for example, former Senator Margaret Rose Henry has served, current Representative Sherry Dorsey Walker did serve, now that she's elected, she isn't on the Board of Parole. Right. That is a place where you really can have an impact too. And that's where you go through a process, putting your name in to the governor's office to be considered, and that's where you can have more diversity as well. The parole board is specific to persons who are incarcerated. Yes. Okay, they are specific to persons who need commutations or a plan of rollout for their release if they don't come before the pardons board. Many of them come before us who have commutations after they've served a certain amount of time, after they've gone through so much programming, and a lot of times it's based upon their sentence. If a person's sentenced to 50 years and they show up before the Board of Pardon only 3 years in, not really likely they're going to have a favorable review because they need to show some good time and changes in their performance. But for diversity purposes, I really like the idea of persons knowing, for example, my office, so that we're in the community, in the field, that we recognize those specific challenges of communities of color. And I think also getting your name in for the parole board, really important. And I can talk a little bit more if you want.
I would, about parties. If you would like to, that's fine. And you said so much, I want to just like jump right on it. You know, no, I'm very glad you're informing the people, which is the whole purpose of this. And so let's talk a little bit. Let's go back because we didn't finish that. You are a professor at the University of Delaware, and you've administered COVID and shots, not COVID, but COVID shots. And so tell us a little bit more about your passion for that and what you were thinking. When is going to be the end site for the COVID, like in Delaware, do you think?
I think national. It's a pandemic, so it's global. So we have a partnership with the world. This past week, we had the European Union President, Senator Chris Coons, and myself, the Governor, Secretary Bullock, the team across the state, Senator Harper, Lisa Blunt Rochester, where we were talking about this. Not only in our own neighborhoods, not only in our state, our nation, but our country. We have to get to something called an endemic. And the only way to get there is vaccinations and to make sure that if you're not vaccinating, please wear your mask and get your COVID test and wash your hands. All of those things matter.
Gotta jump in here. So, don't want to scare you off. I was tested this week. I did test negative, so I do not have the COVID problem. But I have to say, finding employment for someone like me who hasn't been vaccinated is becoming a real concern. It's almost as if it's becoming a us against them kind of thing, where people who are vaccinated are thinking that the unvaccinated, they're going to kill them. Like they're going to get sick from being around us. The mandate, what are your thoughts on that? And my body, my choice.
Right. And these are the tough conversations, and this is something I've spent 3 decades. So it's not new. Monday morning, 8 a.m. for 25 years, I taught public health and epidemiology. And in every infectious disease process, people have choices to make. The challenge we run into now with the pandemic is that really until we can get a global 80% of persons vaccinated, it's going to be significantly hard. And you know the risk, and everybody knows your risk. And the mandates and all these things, at the end of the day, folks, you know your family, you know yourselves. I cannot tell you, and again, I'm not doing this to fear you, I'm not shaming you, because you have choices. And I teach this, so I'd like if I were in my class of nurses. People have to be informed. The risk right now, we have 200 people hospitalized in Delaware, 26 on ventilators. This week, I don't want to get the wrong statistics, but it varies. Some week it's 75%, some week it's 95%, are unvaccinated. Great risk. If you have a loved one, an auntie, a grandma, and has chronic disease, even if they are vaccinated, very low percent, can still contract the virus. Think hard about if you want to be the person responsible. Now, with the mandates of vaccinations in homes where people are in health care, I respect our long-term care facilities, and I respect some of the national policy views who are saying, folks, you're working with a high-risk group. You're a health provider. You need to be vaccinated or have a religious exemption or a medical reason. There are some persons who really cannot have the vaccine, and that's in every population. But we got to get to the 80%. You have to get to the 80%. And so I knew today that you were COVID tested. You had a negative test. We're sitting here, we're talking. Obviously, I'm vaccinated.
Yes.
Obviously. But we have to have that balance. So for those who have been vaccinated, thank you, because you're helping us get to that 80%. Really important. And that's when we'll get out of this. Because I'm sick of it. Hasn't it been like a dog year?
It's really
like
pretty awful, and I feel the worst. I feel the worst for the young people and the children, and just.
And they're going to have vaccines soon. We're going to have vaccines available for kids.
Yes.
It's no different than polio, infectious disease, MMR. The one thing that has driven me crazy in this whole conversation, there's a reason it says 19. It's been studied for 19 years. A black female scientist at the NIH is the lead scientist on COVID in America.
She created the vaccine, right?
She is one of the persons who helped with the science.
Yes.
The pharmaceutical companies have created the vaccine, but her science has been there.
Yes.
So it's not new. What made me upset was it happened during a pandemic. During a presidential election.
Yeah.
So if we had a pandemic and a non-presidential election, we probably would have gotten to 80% sooner. But we had a lot of fears going on. So we are where we are.
Yeah.
So for now, what I would like to say is for those who want to get vaccinated, we have plenty of resources for you.
Yes.
We can give you the information on how to do that. We can get you the testing. And we can get back to what we were talking about, the mental health piece. We can get you services if you're scared, in isolation, anxiety, depression. We have free service. We have free help for you, which is huge.
Yes.
And our inmates in our prisons, we've got folks there, the opportunity to be vaccinated. We're really trying to make sure they get all the services that they need to.
Yes. My son actually, his name is Justin, so he was vaccinated, and he just got a job inside of the prison, which I'm working on getting him a trade until I can work on his commutation
to have a
papers.
release plan.
Yes,
right.
Yeah, to have a release plan.
And persons need to know it is not that hard. If you're out there and you've been walking around for years, not fully maximizing your potential, you can get a pardon, or at least apply. You may not get it on the first try.
Yeah.
It's not about how many times you get knocked down, it's how many times you get up.
Right.
And I would encourage you, we've got an incredible person, Ms. Butler and Apex, that are persons who are out there that will help you.
Yes.
It is not as hard. And I'm amazed at how many people have walked around for years without fully having the housing they deserve, the jobs they could go for, who've changed their lives.
Yes.
They're 180 degrees of who they were, and they haven't applied because they are so fearful. Do not fear the process. There is a reason for second chances.
Well, give thanks that there is a second chance, and I'm thankful that you're chairing that. Because I believe that you will make sure that people do get a second chance.
We do. We have a board where people really listen.
Yeah.
And we've changed the process. So maybe 5 years ago, before you heard, you got to wait forever to get heard. We've eliminated the 3-year wait list for the commutation process. We've eliminated the 2-year wait list. I know our governor's office is trying to catch up.
Yeah.
We've sent a lot of paperwork to him. But we really are proud of that effort. We've worked really hard. We didn't stop. We didn't miss a meeting during COVID. We kept at it. We've done everything we can to give people who want a second chance, whether incarcerated with a commutation or persons who are not fully maximized in our community, a chance for a pardon. And criminal justice, social justice, and equity affects our communities of color at a much greater rate.
Yes. But it really affects everyone.
Yes.
Whether it's in our community or outside of our community because of the economics, and workforce and all of these different, it just kind of ripples. It's a rippling effect. Yeah. So it may be most prominent in the Black, Brown, and Golden community, but it definitely affects the entire state of Delaware.
It affects everyone.
Yeah, absolutely. So I'm going to get ready to close out the interview, but I have to ask you, and I don't even know how I want to say it because I want to make sure that I don't put you on the spot, but where do you see yourself in 2 to 4 years in regards to Delaware and government?
Well, it's not a tough question. We all can have aspirations, right? But we can walk out and something happen on the street.
God forbid.
But for me, we're not in my Dover office. And the wall, all I'll say is in the wall of my Dover office has the lieutenant governors, and a large majority of them are now governor. I have aspirations of some capacity. I will always continue to serve the state.
Okay.
I love the state, and like my predecessors, and again, if we were in Dover, you would see all of those who've gone on to be governor. And I look at those often, and I feel that same commitment to serve our state and our community. I can tell you that as a nurse, there's a lot of work post-COVID recovery, and there's a lot of work also in the economic lane to make sure we have the best jobs, that this city and all cities across this state are maximized, and we need to make sure we are the strongest and healthiest for everyday Delawareans. So I'm going to continue to do the things I've done, and what I have done is really fight for everyday Delawareans to make sure we have a health system that works for everybody, that we have an education system no matter your zip code, that you have a child who can go off to a career or college, that we have a healthy environment for all of our families, and that we have economic, really strong, solid economy for both our big business, but our mom and pops. This morning I had breakfast with mom and pop businesses, and we were talking about that. And thank God for our congressional delegates, leadership, our president, and others for allowing our states to have the funds that we've received to survive through this. And we're looking to Washington as they look to the Build Back Better and what that means. And so for me, I'm going to continue every day, morning till night, they know, in my office, morning to night, around the clock, to focus on getting out of this pandemic and to really helping kids. The one thing I did not mention, as a mom and a nurse, if you think about it, between a child's birth and kindergarten, we lose a lot. And we put a lot of emphasis now on high school and all, which is good, and middle school and having counselors. But we have 1,826 days from birth to 5.
Wow.
I'm really putting a lot of emphasis now in that early childhood as well. So, as I think about that wall of LGs who've gone on to governor, everyone has had pillars of interest. And mine continue to be, the economics, the education, and the health of Delawareans to make sure that we really are strong and healthy. And I'm a little competitive.
Yes.
I want Delaware
Would that
to be
be woman power?
Best. Yeah, a little bit. I want Delaware to be the best. Having chaired the National Lieutenant Governor Association, many states are borrowing models of Delaware, but I've also taken other states' models. And that's what I think we'll continue to do. And, we're going to make Delaware strong. I have to give a little shout out to my team. During the pandemic, every state had an increase, a dramatic curve increase in overdose deaths. Delaware, unfortunately, continues to have too many overdoses. One every 22 hours. It's not great. But because of the work of our office with the Behavioral Health Consortium, last year we had only a 5% increase. The nation was a 25 to 30%. That's still too many, but we've made a difference by working together. And that's the kind of initiatives that we really need to do. When we did our census, working with the county, the cities, the towns, we were shut down right when we did our media launch to get our count. The census gives us our Medicaid dollars, our transportation, everything. We were shut down.
COVID shut everything
down. Worked hard, and it counted our inmates and our prison populations are hard to count, and we made sure as these redistricting boundaries of legislators are counted that we didn't miss a person, and we actually just came shy of 1 million, but we were one of only 3 states in the nation, so I'm bragging a little bit on my team, and the partnerships. One of only 3 states that had an increase in every county, and we were one of only 1 state on the entire East Coast that had a 10% increase. And it's because we work, and it's because it's women power and people really putting their foot to the pedal. And so I share those things because Delaware is a community of neighbors. Governor Markell used to say that all the time. We can get things done. And I am optimistic, to answer that question before, when will we get out of this? I'm really hoping that if people are getting vaccinated, masking, doing all these things, that 2022, maybe by the summer, of 2022,
nice.
But a pandemic is dependent really upon the world. And so to people like you, thank you for your heart. I know it's hard to speak out. A lot of people run and hide when they have a life experience that alters their family, that rips them to the core. You've stood up. You've taken your son's journey and you're turning it into power for other people. That's how we can do this. And so I appreciate time that I had today with you. It's been a great experience. I probably didn't answer all your questions.
We didn't get all of them done, but you know what that means?
Yeah.
That means that now you have to have another interview with me.
Maybe we'll do it outside. Maybe
yeah, that would be nice.
That would be fun.
That would be very nice.
If we did it before winter, of course.
I don't know how to say thank you enough, how much I appreciate you as a woman, as a mother, as a human being, and as the Lieutenant Governor for the state of Delaware. And I have a feeling I'm going to keep my good eye on you for where you may be moving and shaking as we move
it's
forward.
Early. It's early. We got to get through the pandemic and get all this other stuff. But I'm going to keep working in the direction of making Delaware strong and healthy.
Yeah, that's awesome. We appreciate you. And we appreciate you for joining us and for staying tuned in for this very important and informed interview today with Lieutenant Governor Dr. Bethany Hall-Long. I'm Rachelle Wilson for Make Some Intelligent Noise. Until next week, talk to you soon. Peace and grace, everyone.
Thank you.